Can fibroids go away on their own? Fibroids typically do not go away on their own. There's a long period of time before menopause where they'll be dealing with lots of uncomfortable, distressing symptoms, which you do not have to live with. Hi, I'm Dr. Andrew Cortes. I'm double board certified in Diagnostic and Interventional Radiology with over 10 years of experience in the treatment of fibroids. Today, I'll be answering your questions about the treatment of fibroids and your options. This is Fibroid Support. At Amarie_97. What are some common symptoms of uterine fibroids? Uterine fibroids can cause menorrhagia, which is prolonged heavy menstrual bleeding, sometimes resulting in anemia if severe enough. They can also contribute to bulk symptoms, that is, symptoms related to their presence or their sheer size or their location. Things like pain, specifically abdominal pain, sometimes back pain, even leg pain, bloating, pressure, abdominal pressure sensations. Some people have a urinary urgency or frequency, constipation in some individuals, and sometimes even pain with sexual intercourse. These are the common symptoms of uterine fibroids. At Kara_Lynn asks, how fast do fibroids grow? Fibroids are hormonally responsive, predominantly to the hormones estrogen and progesterone, especially estrogen. So in high estrogen states, fibroids tend to grow faster. That's actually one of the reasons why hormonal therapies are some of the first-line treatments, but some of these can be intolerable for patients. To answer your question, it depends on the status of the hormones. We have available treatment options to actually help when you have these intolerable side effects in certain individuals. At Emily J83 asks, are fibroids hereditary? Yes, there is a genetic predisposition that increases a woman's chances of developing fibroids. At Sarah's View asks, how are estrogen and fibroids connected? This is a good question because fibroids at their core are hormonally responsive, benign, smooth muscle tumors of the uterus. Since they're benign, they will not overtly or cause deadly harm to you, be fatal, but they can cause many distressing symptoms. And the role between estrogen and fibroids is that high estrogen states increase the chances that the fibroids will grow and keep growing and causing further distressful symptoms to an individual. At Laura_78 asks, is there a link between progesterone and fibroids? Yes, some therapies that actually involve the implementation of progesterone in certain instances to decrease the symptoms related to fibroids. Fortunately, they're not made to be a long-lasting solution, but yes, there is a link between progesterone and fibroids. At Lisa M_balance asks, can fibroids cause hormonal imbalance? So at the core of fibroids and how they grow or respond is usually there is an imbalance in the hormonal environment that they're in. Their presence themselves does not typically cause that imbalance, but they are responsive to that imbalance, but they don't directly cause the hormonal imbalance. At Jen76 asks, is there a relationship between fibroids and menopause? So menopause is essentially the cessation of the menstrual period, menstrual cycle, and as fibroids are very hormonally responsive, particularly to estrogen, fibroids in and of themselves are not related to causing menopause or to bringing about menopause, but when a woman does experience menopause, that can actually lead to an improvement in their fibroid-related symptoms. At Tanya_writes asks, can fibroids cause infertility? The relationship between fibroids and infertility has been studied extensively. There's still ongoing studies into that relationship. The uterus is composed of 3 different layers: endometrium, myometrium, and then the outer layer, typically referred to as perineum. The location of the fibroid in any of these regions of the uterus can sometimes impact fertility. If the fibroid is located in an area that is close to where a fetus is going to mature, then that can surely make it difficult for that pregnancy to progress normally. It can also make it difficult in the beginning stages when an embryo is trying to implant in those layers, the appropriate layers in the uterus. So yes, certain fibroids, depending on their location, can impact fertility. At Jenna C_86 asks, can I check for fibroids at home? Fibroids are benign, non-cancerous growths in the uterus. If they become large, so if they become extensive, then they can cause abdominal distension, and some of them are palpable, or you can feel them. The best way to check for fibroids, however, is to have a dedicated physical examination by a trained specialist, followed by some type of imaging of the pelvis region. Typically, ultrasound or MRI are the best modalities to further investigate. At Cat R89 asks, can fibroids stop my period? Fibroids typically are not associated with bringing about a cessation of periods, something referred to as amenorrhea. Amenorrhea has many different causes, of which a dedicated workup would be recommended for. But fibroids typically are not associated with stopping periods or causing amenorrhea. Usually, the symptoms that my patients come with are more of heavy menstrual bleeding. At Sophie74 asks, what does fibroid pain feel like? Fibroid pain can be experienced in a lot of different ways, and many of my patients have told me a few different things. Some of them experience a dull, generalized aching in the abdominal region. Some other patients have experienced a sharp or a knife-like kind of stabbing sensation, whereas other patients just feel kind of a bloated pressure, heavy feeling in the abdomen. These are some of the common sensations when it comes to pain related to fibroids. At Meg_unfiltered asks, is there anything I can do to prevent fibroids? Prevention of fibroids. So why certain women develop fibroids is still unknown or still being actively searched for. But given that fibroids are definitely associated with high estrogen states, things that can decrease those high estrogen states, such as maintaining an optimal healthy weight. It's been shown that excessive fat will store and even lead to increases in estrogen, which can then further increase the chances of developing fibroids. Certain vegetable fats are good for progesterone production, which will help keep the checks and balances. Estrogen, there are certain other foods, high fatty foods, processed foods, things like that will be good to avoid. So a healthy diet. Same goes with alcohol consumption, trying to minimize and not have any excessive alcohol intake, which can also lead to issues with hormonal imbalances. These are a few of the things that can help to try and prevent, but nothing's been 100% been proven to prevent the development of fibroids. Vanessa M85 asks, can fibroids go away on their own? Fibroids typically do not go away on their own, with the caveat being as a woman experiences or reaches menopause, that is when the fibroids typically, their symptoms tend to decrease, lessen, intensify. There's a long period of time before menopause where they'll be dealing with lots of uncomfortable, distressing symptoms, which you do not have to live with for all that time. At Tasha J_08 asks, how can I get rid of fibroids without surgery? Many of my patients are coming to me because they have only been presented with surgical options in the form of hysterectomy, which is the complete removal of their uterus, or certain things like myomectomy, which is a surgical removal of fibroids. Both of these obviously are surgical options. Non-surgical options, which are great: uterine fibroid embolization, minimally invasive treatment, outpatient procedure, no major incisions, no big surgery, in and out the same day, on with your life, less than a week, feeling better, feeling relief. There are some other non-surgical options involving medical therapies. These, however, can be associated with intolerable side effects, so sometimes they're not always the best option for every patient. At Ray Talks asks, is UFE better than other treatments for fibroids? This has been studied extensively, and studies have shown head-to-head UFE versus hysterectomy, UFE versus myomectomy, similar efficacy for both, less complications, and lower length of recovery, a lot more tolerable for the uterine fibroid embolization or the UFE. So that's the main difference between UFE and the surgical option. At Sophia_W asks, can you explain step by step what happens during a UFE? I love these types of questions because it's really why I got into the field that I am in, because patients find it so amazing, the technologies that we're able to do these days. Basically what happens is through very, very needle-sized punctures, usually in either the wrist or the groin, there is insertion of a small little tube, a catheter, tiny little tube, and using live x-ray machine, something called fluoroscopy, watch as we advance the catheter all the way to the little arteries that are responsible for feeding the blood supply to the fibroids. With the little tiny catheter in the right spot, we inject these little small biocompatible particles that will essentially block up the blood supply to the fibroids, preserving the uterus, remove the catheter, and that's it. Little needle hole incision, you go to recovery thereafter. Typically the recovery, feeling back to like your normal self in about a week. So that's basically how simple a uterine fibroid embolization is. At H_Atwood asks, am I a good candidate for UFE? Many of my patients have this similar question, and the answer all depends on everyone's individual circumstances. So overarching, people who do not, or patients that would not qualify. Asymptomatic fibroids, so certain individuals come, they have imaging for some other reason, maybe a CAT scan or something of the abdomen. It was just shown that they have fibroids. They have no symptoms, nothing that really bothers them. The presence of fibroids in and of itself does not necessitate having to do an intervention for them. If you have symptoms, distressed by the symptoms, that's when you want to do the intervention. Active pregnancy, again, that would not qualify if you are actively pregnant. Any other sources of active infection or any infections in the pelvis, also you would not qualify at that time. Other than that, there's multiple other patients that would benefit, especially patients that might be high risk for surgery. This might be a good option because it's a very low risk procedure that's done outpatient, and it can help those people that are not even given that surgical option. At Melissa J82 asks, how long does a UFE procedure take? Skilled hands, a UFE procedure can take anywhere from 30 minutes, 45 minutes, sometimes an hour or a little bit more. What determines the length of time basically is each patient's individual anatomy. Everybody's anatomy is a little bit unique. We all have these commonalities, but everyone actually has a little bit of uniqueness to them. And that's why it's important that a trained individual who is specialized with embolization techniques is available so that they've experienced, they've seen these different little nuances. They're able to figure out on the fly what has to be done. At R_Blake77 asks, what is the expected recovery time after UFE and how will I be monitored? So in the short interval, right after you have the UFE, what I do with my patients, we are seen in a recovery unit. About an hour to 2 hours typically is the recovery time after the procedure. Once it's verified that you're in a nice, stable, comfortable state, you're able to be discharged. And then at home, you're provided with phone numbers, contact information, and we're in frequent contact with you to see how you're doing, especially during that first week of recovery. About a week, sometimes a little bit less, that's when you can expect to get back to your normal self, more or less. Probably even greater than what you were feeling before, because a lot of your symptoms will already have been starting to improve by then. At Jesslyn21 asks, are there any side effects of UFE? There are no severe side effects of UFE. For the first week after the UFE procedure, you can expect to have a little bit of a recovery period as your body is adjusting to the state that was just placed in. This is readily managed by myself, by our team. We're in ready contact with you to deal with any needs that you have during that 1 week of recovery, but then you'll be back feeling better than ever after that. At Olivia H81 asks, how does UFE affect fertility? Does it change my hormone levels? The relation between UFE and fertility has also been studied. Many patients have had UFE and gone on to have normal, healthy pregnancies. In certain situations, some patients who were at one time infertile or having difficulty becoming pregnant have also had successful pregnancies after procedure. When it comes to hormone levels, typically fibroids are hormone responsive, So they are dealing with basically being in a hormonal imbalance state or living in that state. They're the receivers of that hormonal imbalance, the estrogen imbalance, causing them to grow at certain rates. Anna Marie R asks, will my fibroids come back after UFE or other treatments? Fibroids that are adequately treated will not come back after having a UFE or other treatments. If it's necessary, we can always take another MRI at some point in the future. That is extremely rare for that to happen. Patients develop new fibroids after treatments, then those might be responsible for symptoms in the future. Mandy Q asks, what happens if fibroids go untreated? The mere presence of fibroids in and of themselves, they are non-cancerous growths. Very, very rarely, talking less than 2% or 1% of the time, certain fibroids may transform into something called leiomyosarcoma, which is a cancerous growth. Extremely rare. The majority of patients, the presence of fibroids, if they're not causing you any problems at all, will not do anything to you. The patients that have distressing symptoms, those symptoms, heavy menstrual bleeding, prolonged bleeding, the need for iron, the need for transfusions, pain, pressure, bloating, all these symptoms will just continue. Sometimes they can even get a little bit worse if fibroids increase in size, transform. So those are all the reasons why we have these beneficial treatments for you to help with those distressing symptoms. Nina_LW asks, can fibroids burst? Fibroids do not burst. They will not burst. Fibroids can undergo complications. Some things are called infarction, necrosis. This is when the fibroid itself outgrows its blood supply and parts of it are actually dying on the inside, and they can actually be pretty painful episodes when that happens. Certain fibroids, if they're big enough and they're attached to a little stalk, sometimes they can actually twist on themselves. That's called torsion. That's actually also a very, very painful episode. A lot of these things will necessitate a trip to the emergency department in certain individuals. Rare occasion, they can actually undergo some bleeding on the inside of the fibroid. That's called a hemorrhagic complication and hemorrhagic fibroid on the inside of it. But in terms of bursting the confines, not typically. @DrinaV_74 asks, where can I go for fibroid treatment? Glad that you asked. We have readily available facilities here at the Fibroid Pain Center, facilities that are outpatient, where you can receive your treatment and go home on the same day. Other institutions involve things like hospitals, sometimes overnight stays in hospitals, especially if you're having a surgery or more complicated surgery. All those types of things can be avoided by going to a specialty center like this, where the process is streamlined for you, effective and easy. That was all of the questions there. Again, just to reiterate, I am Dr. Andrew Cortes, double board certified in Diagnostic and Interventional Radiology. If you're experiencing any of these distressing symptoms, come make a consultation. We will do our assessment and we can get you the relief that you're seeking.